Okay, so what happens during their cancer scans that are coming up in just shy of 2 weeks? So I was going to talk about that real quick. So just to start, when they first started going under anesthesia for these cancer scans, they couldn't go under anesthesia until they were 4 months old. But Miss Eve she was in a different hospital, and she had already gone under anesthesia by the time she was 4 months. So many times, I cannot even count, for her twisted bowel and her bowel remover. But Ella could not go under anesthesia until she was 4 months older for her cancer scans. So up until the 4 months, we just did the cancer scans without any anesthesia. And I'd be in the room with her, and when the doctors would come in, there would be like 7 of them, and they would say, you might not want to watch this because it's hard to watch. And I really couldn't, because there would be like 7 or 8 doctors, and they're all trying to hold a little baby down and do this cancer scan, because you have to do a really thorough job. So let me just talk about that. So when they would do the cancer scans, before Ella was able to go under anesthesia, they would all, swaddle her, and then they would use little tiny eye forceps and hold open the eyelids, which would scare her completely, and she'd be screaming at the top of her lungs. So that's how they would do it that way. But now they go under anesthesia, and they do it the same way. They use the forceps, they open the eyes while they're under anesthesia, and they do a real good look. They take pictures, and they see if there's any activity in there. And that's how we know if Ella and Eve, if they're having a recurrence, or if their tumors that they currently have are growing again. So, and when they wake up from that anesthesia, it's really hard, because they also go under for MRIs. Those are actually pretty easy when they wake up. But when they wake up from this one, they're in a lot of pain, and it's really hard on them, and they cry for most of the day. Even now that they're 4 years old, they still struggle with this, and it's really hard on them. So yes, that's the cancer scans we have coming up, and it's really hard leading up to that for me, not for them, because I don't talk about it around them, but it's hard for me because I'm just so nervous, because we're about to find out where they're at with their cancer. So I don't know, my mental health has really been struggling, I guess for obvious reasons, for the past couple weeks, but I just want to talk about that for a little bit. And I am seeing a therapist, and I am on medication, but we have to ride through this journey and be strong for our twins.